Hello, and welcome back to another episode of the EP Growth Podcast. I'm your host, Ryan McCarthy, the director at Hunter Rehab and Health. And I'm joined by a very special guest today, Anita Hobson Powell. How are you, Anita?
I'm very well, thank you. Thanks for having me along.
Excellent. No, very, very excited to have you on board. I've been looking forward to this chat for quite some time now. And yeah, it'd be great to get an insight into all things that you've been doing at the moment. There's been a few moving parts in your life at the moment. Is that correct?
Yes, I was going to say the last 12 months has been a whirlwind. Probably some would say it's my midlife crisis coming along, but yeah, it's been very busy, very hectic, and just lots of new, which has been actually quite wonderful.
Yeah. So tell us a little bit about that. So I want us just to start from the very beginning because a lot of our EPs listeners are quite young, and yeah, you've been in the EP industry for quite some time now. So give us a little bit of background into, I guess, yeah, how you got into EP, and then your career progressions from there to where you are now as Chief Allied Health Officer of Australia.
Yeah, look, for the young listeners, a bit of a history lesson here is so I was one of those graduates that came out where EP profession did not exist. We were 4-year human movements graduates. Um, and yeah, so we weren't exercise scientists, but I wouldn't say we were exercise physiologists either. We were sort of did sport, general fitness and clinical. So you probably didn't have those full scopes, but you had to be a real generalist. And so um, when I graduated, I was actually very fortunate. I had my jobs in my fourth year of university. So and it was really hard to get jobs. So you would often have multiple jobs, not a full-time career. So I had work. I was a gymnastics coach. I did that all through university, so I kept coaching. I was also working for the university, had a Centre for Physical Activity and Sport Education, and I was fortunate to get a contract with one of the state sporting organisations and was doing their strength and conditioning and some of their training camps in organising their workshops. I did my practicum hours back then, you got one site only. You had to do 300 hours. So I did mine at the Queensland Academy of Sport in biomechanics. And
Yep.
so I was fortunate then I got a casual job as a biomechanics gopher type role, helping with big testing days. And then my other piece of work was I was working for the Brisbane City Council in their corporate gym. And back those days in a gym was pretty much where human movement graduates got jobs. Because there was no EP professions, that's where we headed. And back then, gyms were very different as well. So you got hired as a gym supervisor, and gyms provided free assessments, free programs. Always had supervisors on the floor. That was part of your fees. And so working in a corporate gym, so you had those who just wanted to be fit and healthy, but you also had return to work people. You also had, being the Brisbane City Council, I guess, employees who had very physically demanding jobs. So there was also a component of making sure that they were fit and able to do their job. So it was a good mixture of what, I guess, a few clinical, few return to work, referred, just keeping them fit and healthy. So I did that. I then went over to Canada actually and did my master's by research. So they called it kinesiology over there instead of human movements. And my big interest was in gymnastics injuries. So I did my research there, worked over there as well, came back and actually went the education route was a bit different. So I worked for Gymnastics Queensland in running their coach education, and then went to the Sports Commission and was working in their coaching and officiating units. And then I had my daughter, and I thought, you know what, sport was not sort of the direction I wanted to go in. And I thought, no, I'm going to go back to my more exercise prescription routes. And back then, gyms still EP profession did not exist, and gyms were changing. So we were starting to see that gyms were not full service anymore. That graduates paid a fee to rent space in a gym, and then you had to get your clients that way. And I didn't really like that model. Still don't like that model. And I got a job at the local TAFE. And so part of it was teaching into their fitness program, but they also had a community gym. And this gym was still old school. So it was because it was a teaching gym as well. Full service, they got their assessments and programs anywhere between every 4 and 8 weeks. Being a community gym, it was in an area where it's older population, and also because of it being a teaching gym, it was relatively cheap as well. So teaching, I knew what the students were being taught, and so I was sort of not following rules, and I wouldn't let the students touch anyone with a clinical condition. So they could have people who had well, I would let them see them if they had blood pressure medications or cholesterol medications, but everyone else, they had to go by me. So
Yeah.
um, I had, yeah, so a lot were over 50 that came in, quite a lot over 40, 65. Um, Diabetics, people with mental health presentations, hip knee replacements, cancer, lower back. So it was quite a mixture of it. And yes, so I did that then for a couple years, and it was nice to get back to that background, and I was really enjoying being able to feel like you're making a difference, finally, because that's why I felt like I left sport. Was I really just didn't feel like I was making a difference to anyone's lives, really.
Yeah.
Um, and at that point, it became 2006, which is when EP became recognized. And so I was on the website thinking I would like to get back involved with, it was back then ACE, and yeah, got involved, and then saw a job at the organization. Applied. It was a different role that I really applied for, but just got in there, started working, and then ended up being employed as their, back then it was their executive officer, and then moved on to the CEO role. And I guess during that time, it gave me exposure to all the other allied health colleagues. And my leadership style is very collaborative style. So I worked really close with all of my colleagues, and so got nominated and voted onto the board of Allied Health Professions Australia. And then I was one of the founders of the National Alliance of Self-Regulating Health Professions. And then I was chairing that for a while. And it was sort of that work of getting to know the wider allied health industry, the sector, what were the key issues in for those different professions as well, that then led me to, I guess, this chief allied health officer role. So I've been there almost 4 months now, so still a spring chicken in the role of government, and yeah, just loving the role to be able to make a difference at such a big level now.
Yeah, that's so fascinating hearing your story and just how much you, I guess, jumped around and sort of tested different areas to figure out what you like. I guess as you progress through your career, what advice would you have for younger EPs? Would you say that was advantageous to you to try so many different things and like so many different sectors, so many different types of roles?
Yeah, look, I think a lot of it was the nature of the time where EP wasn't defined. So you
Mm.
didn't do a degree and go, this is where I'm going. Like I'm sure my parents are going, what is she going to do when she graduates? Because it wasn't a clear pathway. So I think a bit of it was you went where the work was. But it certainly for me, it was I've always been a person that I want to make a difference. And if my job is not helping to do that, then I'm going to find something else. So that was part of it. But I do think for graduates to know that you just have these moments where doors open, or you pick up a particular project, or you get a bit of an interest with a client and go, actually, I never thought I would like oncology, but I do. And so I'm going to head in this pathway. I think
Mm.
young graduates need to have a lot of exposure to understand what their interests are. But I think, yeah, don't be afraid to just wait for that moment where you go, actually, I'm going to step into this door. And I think there's lots of opportunities now that you can always go back. But yeah, I think just be open to where the journey takes you.
Yeah, I think that's great advice. And I think, well, by the sounds of it, you would have had a big steep learning curve in terms of leadership. Yeah, joining into ESSA, and now, yeah, obviously 17 years with them, and then on to Chief Allied Health Officer. I guess if you're looking back, say 15 years or so, what are the key things you look back on and wish you knew now about leadership, or things that you've learned more recently that I guess you wish you would have known, or would have done differently?
Yeah, I was gonna say it's probably a lot. I think that's the whole point of a leadership journey is it's always evolving, and I'm a big person of being a reflective learner. So, most evenings I sit back and think about the day and go, what worked, what didn't work, what am I going to do differently? So I think the big thing around leadership is what you were, at the start of your career is definitely not how you're going to end up. I think the big one for me that I wish that I had earlier in my career was the confidence in my leadership style. And so I'm gonna mainly talk to the female listeners, but I think for the male listeners, there's a bit of learning too around. Um, I had a lot of like multiple careers that you've just heard about. Most of them were males, that my bosses, and so I would often get feedback from them around changing my leadership style or how I presented or had that presence, and it was often them wanting me to be like them. And there's a lot of research out there to show that males and females have different leadership styles and they have different strengths. And I felt after doing a lot of reflections that a lot of the times the feedback I was getting was actually reducing what I think were my strengths. And so I would always take on board, try and make changes, and I'd find it just wasn't working, and so I'd naturally go back to my style and get another bit of feedback, and then I'd move back. But yeah, I just got to the point where I had the confidence to say, I'm just letting that go through to the keeper. I know what makes me a good leader. I know what works for me. I'm not going to listen to some of the feedback that particularly is taking away from my strengths. And I think I've learnt, like I was learning that along the way, but I actually learnt most of that actually since I've left ESSA. I was getting a lot of feedback from the staff, ex-board, key stakeholders, and now when I meet with external stakeholders in my CAHO role, this is what one of the first things people say is they're reflecting on my leadership and that my style of leadership. They would give specific examples, so it wasn't just a flying comment, and it made me realize, and I guess giving me more confidence in my style. It's not for everyone, but it's what works for me. And yeah, I think it's more that confidence to say, okay, I'm listening, but thank you. I'm not changing. This is how I know I can lead. So I think, you just have to work through the flow, and I think you need to be reflective, but I think you need to get that, you know, gut feeling of this is my style and I know I get best outcomes based on these strengths, and not worry about sometimes what other people say, because sometimes it's they're more comfortable in their style, and that's okay too, but doesn't mean I have to be just like you.
Yeah, that's great advice. And I guess what are some of those key attributes of that style? I think would you say it's like that collaborative approach? And I'm just trying to I'm making assumptions in my head that these males are saying from more of like an authoritarian approach from leadership, and
Yeah,
tell us a bit more about
yeah,
that.
yeah, for sure. Definitely probably sometimes it was my way or the highway, like you're going to follow what I want you to do. It was, you will listen because I'm in a position of power and therefore you're my subordinate, do as you're told. Um, that's just not my style at all. For me, it is collaborative. We're part of a team. I did not, there were times, yes, I would have to make captain's calls, but we were a team and everyone has their right to have their opinions, thoughts in. You got better outcomes. I didn't shy away from having difficult conversations or sort of encouraging conflict, because I think you get better outcomes when you're sort of debating issues, not being closed minded on understanding different people's perspectives. So that was it. On the wider allied health perspective, I had a very strong opinion, and still to this day, and I think it's been validated now I'm in government, knowing their expectations of, allied health is the third workforce, and doctors, nurses have always come for first. There is 25 allied health professions. We need to work together, collaborate together, not have turf wars. To
Mm.
have a strong voice, we need to be saying the same thing. So I would want to meet with my colleagues. Had very good relationships with 90% of them. And, we would put submissions in together. There was not often that ESSA would put on, or would share advice, or would go, sometimes it'd be better if we did this under this banner. So we had a collective voice rather than, sometimes, yes, ESSA went alone, but collective voice is what government want to hear.
Yep.
So it was picking the right direction. So I think my collaborative style is what has actually resonated more now in the role, and people are aware that, you know, the only way allied health is going to move forward is if we're all united.
Yeah, exactly right. And I guess just one more question around that leadership style. Like in this day and age, we're working a lot more, yeah, hybrid and remotely. And yeah, how do you effectively lead when we're working from home or in these hybrid roles? And you're talking about collaboration, and you're not physically seeing your team members
Yep.
as much. And I think, yeah, you more so than anyone has worked for such a long time. Yeah, in
In a
this role. So yeah,
yes.
I think you can
Yes.
do it really well, being a great leader and working remotely at the same time. I'm very intrigued because I've got the same challenge myself.
Yeah, so I've been doing it. This is the 11th year I think I've worked hybridly. Uh Look, it's just like leadership in that, I guess leadership generally, in that you need to test your hybrid work relationships with people and keep evolving them. Like, I think if you think you're face to face and then move hybrid, it's going to be exactly the same.
Mhm.
It's not. And people respond differently in hybrid working relationships. So I think again, you need just go, I got a different team or a different individual. I might need to change. They may need to change. So I think again, it's don't be stuck in the ways that you're doing things. Um, for me, it was though trying to have some rules and boundaries around what hybrid working looks like. Around, for me, I'm working from home today. I dress like I'm going into the office. Like for me, it's a mindset.
Yep.
I put the makeup on, I dress like I'm going out because that's my home life. This is my walk into the office. So for me, it's a mindset as well. I always wanted cameras on when having team meetings. To me, it's a sign of disrespect not to have it on. It is, I can't have engagement. I can't read you if your camera's off. So didn't always work, but people knew that that was my expectations. And even to this day, I will always have my camera on. I think the challenge is you have to reconsider how you're communicating. You need to consider around, the passing hall comments, sitting by the coffee shop down the corner, all of those little things start to disappear. So you need to understand what presence looks like. Um, One of the things that I learned when I started working hybridly with ESSA, one of the feedbacks was, I wasn't, they missed sitting down and having lunch with me. So I tried to make sure that the days I was in the office, I sat in the kitchen. So that was surprisingly really important. So, how do you get out on the floor, making that conscious effort? I think it's also being aware of the unconscious bias around people working from home as well. So there's research actually now to show that people's leadership progression is often hindered if they're working from home or hybridly because they're not front in mind. You're not seeing them, so you kind of do forget about them. So, like, how do you make sure if you're looking after staff that you are having career progression options for those people, and it's not just those who are turning up? But I also think it's important for those who are working hybridly. They need to also look at their presence when they're in, or how do they, I think people just get behind emails and forget to pick up the phone. uh,
Mm,
we do in government a lot of Teams calls, like, and cameras are on, like phones hardly get used at all. It's all Teams calls. So that visual interaction, I think, is really critical. But I think it's, to be honest, it's the way the world's going to work. So I think you need to learn what's working. You need to get feedback on what's not working. Um, yeah, it's challenging, I think.
mm.
Yeah,
Yeah, no, I think the key learning I got from that is that it's ever evolving, and you get feedback from your relationships with your colleagues to see if it's satisfying their needs, and you work back and forth to figure
correct.
out, yeah,
Correct.
what works.
Absolutely.
Yeah. Yeah, that's a
Absolutely.
great learning there. Let's fast forward to your current role at the moment, Chief Allied Health Officer of Australia. I'm sure there's a lot involved in that role, but I guess, can you summarize what success in that role looks like? What is the gold star? What is success in that role look like?
So I've got three main objectives that need to achieve, and they're kind of big ones and multifaceted. So one is around getting the people to understand the value of allied health, and because there's so many professions, how can they help people achieve better outcomes with their patients? How can they achieve reduced hospital admissions? How can they keep people at home longer? So it's telling the story about the achievements that allied health can provide. The next one is around collaboration. So, which was music to my ears that they wanted that. But how do I get the sector to collaborate better? To talk with united voices. How do we all get the same outcomes? How do we reduce the turf wars that are happening? And it's not just across professions; it's within professions as well. So, really trying to address that, because one of the key things I've learnt, and the minister said this in a forum. He said, how can policymakers make a decision if they're getting conflicting information? So, how do we make sure that the Minister for Allied Health knows what allied health want? He's got so much to know about as well. But if allied health is saying the same thing, it's going to make life a lot easier for him making decisions. And the last one, and that's the last one, and it becomes the sort of big one that we want, is how are we included within health reforms, policies, programs? How are we not just included, but how we at the decision making table to decide on how we are best utilized rather than other people deciding how we should be utilized? So they're sort of the big things that I've got to achieve. The first big meaningful thing, though, I have to deliver on is delivering our first national workforce strategy for allied health. And the big ones there is defining what is allied health. So I am going to be tackling that over the next 12 months, and then also looking at data. So data about the allied health workforce, who we are, what we do, what sectors we're working on, and then also importantly, what services we're providing. That data is inconsistent and it is not consolidated. So, how do we set up appropriate data governance to make sure that we can start collecting and understanding our workforce a little bit better.
Yeah, and then you can provide a clear sort of streamlined bit of information to the minister, and not
It helps with all of the other work is if I know what we're doing and capable of doing. So yes, it will help with a lot more evidence to help the minister make decisions for sure.
Yeah, excellent. I'm really excited about that. I've been an EP for 12 years now, and I've been saying from the get-go that EP will it's growing. It's obviously growing exponentially, but I said it'll grow even more once we have people in those rooms with those decision makers that have experience being an EP. I think that the biggest barrier in the past was EP being such a young profession. We didn't have EPs in these decision making rooms with these policymakers, so there's no awareness of EP. So it was very hard for EP to progress from a larger scale. But only as we progress as a profession, and people like yourself are in these roles, and then I think it can progress even more. So going into a bit more specific EP, I think what's your vision for exercise physiologists within that over the next 10 years?
Yeah, look, it will be that access to services and being able to show the value that EPs can provide. So I guess in my role, I can't advocate for any particular profession. I have to talk allied health, but like you said, is I go to these events and I've just done 2 weeks of road showing and doing keynote speaking roles. I introduced myself as an exercise physiologist. So I'm grateful now I really don't have to tell people what that is. Most people know what an exercise physiologist is, but it things like that help to draw attention to the professions. It helps to not just think about the main ones or the ones who've been around for 100 years or more. There are some professions. I think like you were saying before, is it helps with you don't know what you can go and do if you don't see it. There's a really good phrase about that, but I'm really bad at remembering phrases. But like you can, it gives you the give stakeholders to know that chief allied health officer roles around the country or directors of allied health in hospitals that you can consider having an exercise physiologist who is that person now. And we're starting to see that around the country that it's not just the big professions that are taking on those roles. So I'm hoping that it naturally will see that some of the smaller professions now go into those roles. um, I think it's also around making sure that because we've got so many allied health professions, is allowing people to know what everyone's scopes are and that scopes are changing as well. So every profession, if you look back to how they originally started, like I was saying before, EP did not exist. And when we first came out, we did training only in musculoskeletal, neurological, respiratory, and pulmonary. 4 areas. Look at our scope now, so it's expanding. Every profession's exactly the same. So it's respecting scopes are growing. It's respecting that there is that much need for allied health in the country that we don't need the turf wars. We have plenty of work. Working in multidisciplinary teams actually gets the outcomes for the patients as well. But I think it is about getting respect for everyone's roles in the teams is the key thing that I'm trying to achieve. And given I'm an EP, I do give examples when I go to these meetings. I actually talk about diabetes and pre-diabetics all the time in the prevention space of, it comes naturally to me to say, well, this is what happens in this space. I do talk about other professions, but, I can talk about the clients that I worked with. I can talk about the challenges that we're seeing. I can reflect on everything that I've learnt at ESSA around what the members were saying and their struggles. So I think, I can take that on board and try and use that more of in a generic sense as well.
Yeah. There's so much great information out there, and I think so many people need to know about it. So I think I still remember the Deloitte report that Tessa consulted with Deloitte about, and I still go out to GPs and show them the value that we provide. I'm like, it's right here on paper, like it says it's here. But it's just getting that information out on the wider scale. I had a quick thought then when you were talking about the different scopes, and I thought, yeah, would you ever think in 10, 15, 20 years time there'd ever be a merge in allied health professions to be more like, like there might be a merge because there's such a bit of a crossover now within scopes where it's more, we could just be called allied health coach or something like that. Do you think that's ever possible?
No one's asked me that question. I don't think so. To be honest, I'm actually seeing it more in splitting off and specialization. So, for example, um, we have hand therapists. So they are physios and OTs who just work in the hands, and that's now a dedicated profession. I guess you could generically, and I'm sure that I'll get lots of feedback from people on this one. But we have sort of that counselling space, but um, so we have music therapists, we have arts therapists, we have play therapists. They're in the same thing, they're achieving the same thing, but they're using a different tool to help with the delivery of their services. So I'm actually seeing more specializations that are happening. Um, but look, whether every profession is going to exist in the future, I'm not really sure. Like technology is changing, AI is coming into place. I think that there will be changes and scopes will change, and maybe, yeah, some professions will merge with others or something will completely replace it. Probably not in the next 10 years, but maybe 20, 25 years. Yes, I think that we'll start to see some changes for sure.
Yeah. Well, with the amount of changes there's been in the last sort of 10 years or so, it's exciting to hear what could happen in the next 10, 15, 20 years.
Yeah.
Very, very exciting. All right, I think that's just about us for time. But is there any sort of final messages for the listeners, for the young EPs that listen to this episode?
Yeah, look, I'm gonna just go jump in one really quick thing. So
Mm.
I'm gonna just take an extra couple minutes.
Yeah.
Is don't underestimate the role that you have as an individual in driving change. There's a lot of reforms going on at the moment, and to be honest, for them to work effectively, it's actually at the grassroots that it's going to make the difference. So I'll give a specific example is we've got the PHNs who are doing multidisciplinary team commissioning. If you get on one of those projects, you need to consider the weight that is on you, not just you as a person, not as you as your business, but actually you're representing all of exercise physiology. And so, if those projects where you're working with doctors and nurses have great outcomes, that doctor is going to possibly think about other patient cohorts, or he's going to tell the other doctors in his clinic, or he's going to go to, he I should have said they, he or she will go to ROCGP conference or the GPCE conference, and they're going to talk about the outcomes they're getting with their patients. So I think more energy needs to be realized that at the grassroots, EPs can make a difference by the relationships, the trust, the outcomes they're getting with their patients, that GPs will embrace it. So don't think that SR or Allied Health Professions Australia or myself is going to drive change. A lot of it can really happen at the grassroots if you're doing your jobs well and you're having great outcomes and relationships with the referrers as well.
Yeah, I think that's great. Great advice. And like I said, there's two ways of it's just a mindset shift, isn't it? It could be blaming others, but or it could be the change that you want to see in the industry.
Correct.
So I
Absolutely.
think I think that's the key message for listeners here. Take that positive, abundant approach and say, what can I do about this? And what change can I make? Because I don't know how many SM members there are now. I don't want to get it wrong. Maybe 10,000, 9, 10, 11.
Yeah, I think it's about 10,000 plus students. Yeah.
Yeah, about 10,000 now. So yeah, with that collective voice, and there are starting to be some really great voices in our industry that are rallying the troops
Correct.
together,
There
which is
are some great voices.
really positive to see. So I think, like I said, that is the most powerful instigator of change is all of us and all of us listeners. So great message to finish on.
Thank you. Thanks for having me.
Excellent. No worries at all. And what's the best way for listeners to follow any updates for yourself?
Yeah, so I have two LinkedIn profiles. So look for the one that says Anita Hobson Powell, and I'll have Carho in brackets. So that's the one where I will be putting information out. You can also subscribe to information from the government website. So when we're going out to consultations, or there is the Carho email address. So CAHO at health.gov.au is the other way to send in any emails that you have.
Perfect. Excellent. I'll put all those in the show notes for the listeners to reach out to. Thank you once again, Anita. Have a great day, and I'll hopefully speak to you soon.
No worries. Thanks, Ryan.
Bye bye.